Hello, everyone. Thank you for watching this short video. I am here with Paula Sadler. She is our yoga and meditation instructor. My name is Ned Corona. I'm the chief of staff here at the YWCA of White Plains in Central Westchester. And today we just wanted to give you a little bit more information about a great program that we have here, funded through the Department of Health, which is our program for holistic wellness, which we provide classes for Tai Chi, yoga, and meditation. So I just wanted to give you a little bit background about the YWCA. So our YWCA is located on North Street, right across the street from the White Plains High School. And we also have our women's residence, which is on North Broadway, both in White Plains, New York. And we offer really great programming here. We have over 12 departments. We offer gymnastics, aquatics. We also offer karate, and we have a lot of mission-based programming as well. We have the Center for Racial Equity. We have supervised visitations. And of course, part of our fitness package, we also offer this program, which is for breast cancer survivors. So a little bit about the program. This program is offered yearly through a grant, which we provide services for breast cancer patients and survivors. So both women that are currently experiencing or undergoing breast cancer treatment or a diagnosis, and also for women or men that have beat breast cancer. So what's really neat about this program is that while we get credit for helping, women who have undergone a diagnosis or survivors, we also encourage caregivers to attend with, their family member that's undergoing this disease. So, that's something really important for us is to make it as family oriented as possible. So, one main question that we get is what makes me eligible? Obviously, a diagnosis or a medical note from your doctor stating that you have or had breast cancer. We really do the honor system here, so we're not gonna call the hospital or anything or confirm. It's really the honor system, and we want to build that trust with you. We also accept caregivers to attend, like I said, and also we also encourage folks who seek these classes, but maybe they don't have breast cancer, while we don't get credit for it under the grant. We have participants who have different types of cancers that this is also beneficial for. We encourage them to attend as well. Another main question that we get is the registration process. So the registration process, really occurs with a participant first, them reaching out. And you can do that by visiting our website, which is ywcawpcw.org. You can also send me an email directly. My email is ncorona, ncorona, at ywcawpcw.org. From there, we'll have an initial conversation. I will provide you with our registration form that you need to fill out and a pre-participant survey. From there, I will pass it on to Paula Sadler, which you will hear in a little bit. And Paula will give you a little bit more detailed information about the classes and what you can expect. Anything from, just laying out expectations for the classes, specifics on when you guys will meet, session dates, what you will wear, that's best suitable for the class, and also how to log in to the class and actually attend it. So she's fabulous for doing that. That's sort of outside of her instruction time. So I thank her for that. I don't know if I could do it without her. So I really thank her. And the last main question that we get is what are the times of the classes? So once you sign up, you will have access to all of our classes, but just for the sake of today's demo, we usually have um, breath and meditation on Mondays from 5 to 6 p.m. Then we have Tai Chi twice a week, Tuesdays and Wednesdays from 6 to 7 p.m. And then lastly, we have yoga on Thursdays from 5 to 6 p.m. So all of this you will receive, formally written once you register with us, and you will have access to the Zoom link and all the information you will need for the class. So now I'm just going to send it over to Paula and invite her to come on, and she will walk us through the rest of the demo today.
Hello, my name is Paula Sadler, and I'm speaking to you today to introduce you to the philosophy of how I teach breath and meditation and yoga. I'm teaching on behalf of the YWCA of White Plains and Central Westchester, and they offer wellness classes to breast cancer patients and survivors. There are also Tai Chi classes that are offered besides the breath and meditation and yoga. I teach based on the Vinyasa School of Yoga. The Vinyasa School of Yoga is based on the Yoga Sutras, which are thousands of years old, and they are the ancient texts that the yogis of old have brought down to us throughout the ages that explain to humans how we can surpass or surmount the physical and the mental and the emotional pain and suffering that we all experience. Yoga is defined as the union of the body and the mind. So the conscious molding of our behavior is our goal so that we can learn how to, as my teacher says, how we can learn to surface the patterns of our behaviors that cause us discomfort in all areas of our life. Vinyasa practices are designed around a person's objectives and abilities. So if you as a client, as a participant in my class, come to me and say, I want to develop better balance, then we will develop a practice to help you do that. Vinyasa starts with the objective that a person has and helps them meet that objective in small and measurable steps in a way to minimize pain and discomfort. For example, breast cancer patients and survivors may have discomforts in certain parts of their body. And the way that we approach the structure of the classes is to help them maximize the movement of their body in parts that are restricted. If you've had breast cancer or surgery for breast cancer or reconstructive surgery, you may find that you have limitations around movement of the arms or the armpits or the shoulders or the back. So the Vinyasa practice that I would design for you will help you to gain some mobility in those areas and to learn to adapt your movements so that you can still move your spine, move your back, move the muscles around your shoulders and around your armpits, and you can do movements that allow you to move your torso in a way that is more comfortable to you. So Vinyasa is designed to work with you and to help you to regain as much functionality as possible in a way that is going to support you at all levels. Physical assessment. As part of the process of designing the classes for breast cancer patients and survivors, one of the first things I will do is to assess your situation. So I will ask you to make movements either seated or standing, where I can determine what is the structure of your body, whether, for example, are you symmetrical, are your shoulders higher than the one shoulder higher than the other? Do you have a certain rotation of your joints? How are your hips and your pelvis aligned? How is your spine aligned? What sort of curvatures do you have in your spine? But these are situations that we as a yoga therapist would assess so that we can design a practice that is appropriate for you. And so the first meeting, the first class would be to have you do some movements, and you can select, some you may want to do standing, some you may want to do sitting, lying on your back, lying on your stomach, etc. So we can assess what you can do and how well you can do it. The benefits of yoga therapy are many, and yoga therapy is designed to address almost every condition that exists that a person can experience. For example, you may have problems with your joints. You may have pain in hips or shoulders or pelvis, knees, ankles, feet, toes, fingers. So there are practices and movements that yoga therapy can do. And one of the special things about yoga therapy is that it really focuses on having a person go internal, to become mindful of what you're doing and how the movements that you're doing or how your practices are affecting you, whether and what you feel like after the practices. So that as you get deeper into the practices, you develop an awareness of how these practices are impacting you and whether that's good or bad, or you need to make adjustments. This is a demo for people who have had breast surgery or surgery around the upper arms or around the armpits. And I was going to show you how we would adapt a practice to meet your situation. We'll take the position of Tadasana. Normally Tadasana is done with the simply inhale by lifting the arms straight up and exhale by lowering the arms. An adaptation for this would be to simply start with the arms together, with the palms together, and on the inhale, open the arms wide, letting the elbows drop, opening the chest, and exhale, closing. Just exercise with me. So just sit in your seat, take your hands, place them simply on top of the knees, and just begin to breathe in. And you may want to just gently feel your ribs as you inhale. You're going to feel your ribs expand, and as you exhale, you're going to feel a gentle contraction in inhale, and you're going to exhale. So let's begin. I'm going to count for you, so you can just close your eyes and relax. So we're going to inhale 4. We're going to exhale 4. Inhale 4. We're going to exhale 4. Inhale. Exhale 5. Inhale 4. Exhale 5. Inhale. Exhale 6. Inhale 4. Exhale 6. Inhale 4. Exhale 6. Inhale 4. Exhale 6. Just let your breath relax. Close your eyes and just be still for a minute. Just bring your awareness gently open. Just notice you. Do you feel a little? Is your mind? Do you feel? Hopefully, the answer to those questions is that you feel calm, relaxed, and is less busy. These are all benefits of a simple breath and meditation practice, which I will, of course, lead you through to longer and more involved practices. And so that essentially concludes the demonstration and the explanation of the approach that I use to teach the yoga, the art, and the breath and meditation. And all the information, if you send a query to Ned Corona, he will forward that to me, and I'll be happy to send you specific information on how you prepare for the class, which is very simple. You just wear comfortable clothes, you have a chair that you can sit in, or a yoga mat. And so with that, I'm going to turn the presentation back over to Ned in case he has any closing remarks, and I want to thank you very much for your attention.
These classes are completely free. They're 100% grant funded, and it's a great opportunity to combat a lot of the, side effects or a lot of the, sort of things that come with a current or sort of beaten breast cancer diagnosis. I just want to reiterate, we do extend this program while our main focus is on breast cancer. We do encourage anyone experiencing any form of cancer. This is beneficial for you as well. So we encourage you to participate and invite any caregiver or family member that you would want to be there with you as encouragement, someone that would benefit as well. Any information you may have, please contact me. Again, my email is ncorona, ncorona, at ywcawpcw.org. Thank you.
Thank you, Ned.